Hello dear friends, welcome to PharmaGrid. So let's start with question number 16. Bright's disease is a term used to describe. The options are musculoskeletal disease characterized by muscle pain, kidney disease characterized by glomerulonephritis and proteinuria, bleeding disorder, none of the above. So here the correct answer is option B, that is kidney disease characterized by glomerulonephritis and proteinuria. The Bright's disease, also known as nephritis or glomerulonephritis, is the inflammation of the structures in the kidney which produce urine, that is the nephrons and the glomeruli. Inflammatory or degenerative kidney disease is characterized by proteinuria and hematuria and sometimes by edema, hypertension and nitrogen retention. Question number 17. Anemia of chronic renal disease is a form of. The options are normocytic normochromic anemia, microcytic anemia, macrocytic anemia, none of the above. Here the correct answer is option A, that is normocytic normochromic anemia. So anemia of renal disease is a hypoproliferative anemia resulting primarily from deficient erythropoietin or a diminished response to it. It tends to be normocytic and normochromic. So the treatment measures include to correct the underlying disorder and supplementation with erythropoietin and sometimes iron. Hypoproliferative anemia is defined by the production of an inadequate number of erythrocytes. Erythrocytes means red blood cells to maintain homeostasis. The hallmark is low reticulocyte count, which may be due to bone marrow failure, bone marrow replacement, inflammation, or nutritional deficiencies. Normocytic normochromic anemia is the type of anemia in which the circulating red blood cells are the same size. Same size means normocytic and have normal red color. Hence the name normochromic. So forms of anemia in which the average size and hemoglobin content of the red blood cells are within normal limits are called normocytic normochromic anemias. Next question. Which of the following medication can be used to treat croup disease? The options are doxycycline, acyclovir, dexamethasone, propranolol. Here the correct answer is option C, that is dexamethasone. This croup disease is a very contagious respiratory infection that most commonly affects babies and young children. This condition causes swelling of your child's voice box, that is the larynx, and windpipe, which is the trachea, which leads to symptoms including a distinctive barking cough and raspy breathing. Croup is usually mild, but symptoms can become severe and life-threatening. The most common cause of croup is a viral infection. Croup viruses include parainfluenza, then respiratory syncytial virus, measles, and adenovirus. Dexamethasone is the most frequently used medication for the treatment of all types of croup. It is a glucocorticoid that provides long-lasting and effective treatment. It works by decreasing swelling of the larynx, usually within 6 hours of the first dose. Question number 19. Which among the following opioids cause serotonin syndrome? The options are tramadol, pethidine, fentanyl, all of the above. Here the correct answer is option D, that is all of the above. This pethidine, tramadol and dextromethorphan. Dextromethorphan is a common ingredient in cough medicines. Are opioids with a high risk of causing serotonin syndrome when used with serotonergic antidepressants. Methadone and fentanyl also have serotonergic properties and are considered medium risk for inducing serotonin syndrome. In combination with serotonergic drugs, for example antidepressants, they can provoke serotonin syndrome. In patients with such combinations, special attention should be paid to clinical signs of serotonergic hyperactivity. Higher risk combinations, for example monoamine oxidase inhibitors with tramadol, must be avoided. Question number 20. Which of the following drug has uricosuric effect? The options are losartan, telmisartan, valsartan, all of the above. Here the correct answer is option A, that is losartan. Losartan is the only angiotensin receptor blocker with a uricosuric effect, although a mild one due to inhibition of the urate transporter. Calcium channel blockers and losartan may be protective against the risk of gout among people with a hypertension. These data are compatible with the previous findings that suggested these drugs have urate lowering properties. In contrast, diuretics, beta blockers, angiotensin converting enzyme inhibitors, and non-losartan angiotensin 2 receptor blockers are associated with an increased risk of gout. So with this question, we have finished today's recalls discussion. Thank you for watching this video. Have a nice day.